My name's John Ryan, and I have been an employee of Myriad Genetics for just over the past 12 years. During that period of time, one of my sisters has been diagnosed with breast cancer twice, and my grandfather died from prostate cancer that spread to his bones. My family has a very, very strong history of cancer. And in this latest generation, there's myself and I have two sisters. My eldest sister, Shelley, is a two-time breast cancer survivor. She got breast cancer when she was 36 and also again when she was 39. And the thing about it is, she did not want to get tested. Something that I didn't mention is that I'm a geneticist and I'm very aware of testing for breast and ovarian cancer. And literally for almost 8 years, I had been talking to her about getting tested. And she did not want to for a lot of reasons. And that conversation over time got somewhat contentious. And my poor sister Shelley, she's got a brother who's a geneticist, her dad's a geneticist, her sister-in-law is a geneticist, and her sister is a scientist. And so she's had all these people always pestering her about getting tested. And for me, it was so important because I was so afraid that she was going to get ovarian cancer. And that by the time it was discovered, that the treatment options would be very limited. And I literally lived with this fear in the pit of my stomach for 8 years that I was always waiting for the other shoe to drop with my sister, and that she was going to come and say that she was positive had ovarian cancer, and that I was going to lose her. And it just terrified me. And about 3 years ago, she approached my sister Leslie and me and said she was ready to test. And believe it or not, all these conversations with all these scientists pushing on her to get tested isn't what changed it for her. It was reading the story of another patient and what happened to them. So at that point, my two sisters, Shelley and Leslie, and I made a pact that we would all test. And in my mind at that time, and I think also for my sister Leslie, we really saw this as doing something to get Shelley to test so that she would know her treatment options and be able to act accordingly. Well, Shelley came back positive, Leslie came back positive, and then I came back positive. We all had the BRCA2 mutation. From that, my sister Shelley made a decision to undergo a bilateral mastectomy and a oophorectomy. And with her doing that, I really removed this fear that I had in the pit of my stomach that she was going to get ovarian cancer or another type of breast cancer and die. And I really feel that her treatment options have been driven by the knowledge behind her history of cancer, but also her test result. So for her, I truly see testing as knowledge is power and how it's guided her treatment. My other sister, Leslie, after being tested positive for BRCA2 mutation, made a decision to have a hysterectomy. But she did not have a mastectomy at that time. She was planning on it, but wasn't quite ready to make that decision. In the meantime, her treatment and the surveillance that she was under radically changed because of the fact that she was BRCA2 positive. So again, knowledge is power. During that surveillance, where she would alternate doing a mammogram and an MRA every 6 months, she was found to actually have DCIS, ductal carcinoma in situ. And she was immediately scheduled to undergo a bilateral mastectomy. Again, she would not have been under that surveillance simply from having a family history of breast cancer. But because of that testing result, her treatment and the surveillance that she was under greatly changed. And because of that, caught this cancer at a very early point. So again, for that patient, for my sister, knowledge is power. Since I was diagnosed as being positive for this BRCA2 mutation, I have had to go to my doctor and learn how to do a male breast exam. He actually learned it at the same time I did, and so we kind of walked through it together. And I've had my first mammogram. I've had my PSA level tested, and in my next annual exam, I'm of course going to undergo some testing for prostate cancer. And again, from that patient perspective, the way in which I'm being treated by my doctor is completely different based upon the results of my test. So again, that testing result has guided my healthcare, and it's guided the healthcare of both of my sisters. And so one of the things that my sister Leslie and I always joke about is that we feel like this worry of the future has been, in regards to breast and ovarian cancer, has really been reduced or taken away. And we always talk about the idea of us sitting on a porch together in rockers, the three of us fussing at each other about our sore joints and all of our other ailments because we're old.